Hello, this is me bringing you another tips today. People have been asking me what are the life changes that I said this is a lifestyle change. Yes, if you're considering to do a gastric bypass, which is what I did, the gastric bypass, if you're considering to do that, you should know that there are some things you need to change for the rest of your life. They need to change. It's a lifestyle change. This surgery, this weight loss surgery, is not a cheat way to lose weight. Rather, it's just to help you so that what you're doing will work and to help you teach you how to eat right. So if you're considering this, you need to ask yourself question if you're able to do these things. I'm going to mention because for the rest of your life, they are the things you need to do to make this surgery a success. I've had a lot of people inbox me and say they know people that did this surgery is not and afterwards they start gaining weight. It was not successful for them. Yes, that's because they didn't stick to this lifestyle change. I see a lot of people having this issue when they leave Canada. That's why I like this surgery in Canada. I'm going to, in my other video, talk about the process that Canada takes to do this surgery that makes it different from other countries and how you can qualify to do it in Canada for free. Like it is free to you, paid by the government, right? But before we digress, let's come back to that thing that you need to change, that lifestyle that you need to change, the things you need to do for the rest of your life. If you're able to commit to these things, then yes, the gastric bypass can be a success for you. But before you do it again, I will tell you, I'm not a health practitioner. I'm a doctor of philosophy in materials engineering. I'm just sharing my experience. Make sure you talk with your doctor and talk with your health team. So the things that needs to change for the rest of your life, if you're considering this surgery, is one, that you should be eating slowly and chew your food well for the rest of your life. You must learn to chew food slowly and chew it properly. If not, you'll be having gas problems. I know a lot of people that have dumping syndrome because they chew very fast. Then you need to pay attention to your portion size because you can actually expand that your stomach if you do not pay attention to your portion size. Pay attention to the triggers that tell you you're full. It will be there. It can be different body pains. This will be taught if you're going to do your surgery in Canada, which is why I prefer it than running off to go and do it in Turkey under one day and then you back and trying to learn on the track, which could complicate issues for you, right? Then another one is that you should avoid pop and all carbonated drinks. There is no, yeah, I can take this or cannot take that. I see people saying, but this person was taking this and taking that, and they will say they're 6 months post up, but they have stopped losing weight. When you're taking carbonated drinks and pops, this is what happened. Then for the rest of your life, you need to drink about 6 to 8 cups of sugar-free liquid every day. So for me, my sugar-free liquids are the decaffeinated, that's the leaf teas, decaffeinated tea, and clear water. Clear water is the best if you can keep to it. If not, you can add your decaffeinated tea. Then the next one that is very important and essential to avoid dumping syndrome and complications that will land you in the hospital is that you do not drink water 30 minutes, you do not drink water 30 minutes before food and 30 minutes after food. Because remember, your stomach has been restructured, it's a lot smaller, and your intestine has been reconstructed, right? So it has a small hole now. When you drink water 30 minutes before, what it will be is that it will sit in your stomach. By the time you're eating food, it will flush those food faster, and it could cause blocking. It could cause blockage in your stomach, and that is surgery to correct it. So for the rest of your life, as long as you do the gastric bypass, you have to stop drinking water 30 minutes before you eat your meal and 30 minutes after you eat your meal. Then you have to choose food that are low in fat and sugar. You take your supplement every day. There is no minus this because you know your stomach is being restructured. This surgery works using malabsorption technique, which means whatever you eat, you absorb some of it and your body release some of it. So to make up for that nutrient that you need as a man or a woman for a day, you need to do supplements. You need to have your supplements to augment for those nutrients. And then you have to avoid fast food. Fast food is a no-no. Though honestly, it's difficult to avoid. For me, I did a road trip with my family about 2 weeks or 3 weeks ago. It was difficult to avoid fast food because when we stop on the road, that's what we're going to eat. So what I did was I was always going for the protein options and the vegetable. I was doing Subway with the wrap. Then sometimes I felt like the chicken. Yeah. So I would just get the chicken and take the skin back and take a little and bite it very, if you bite too long to bite it soft, that chewing will even make you start feeling like you're full. But I satisfy that taste. I'm just trying to be realistic and honest with you that it might be difficult to avoid this, but you need to work towards doing that. And when you're doing it, even if you have to do it, make sure it's within your calorie intake. Make sure you're not taking too much of the wrong decision. I still go to Tim Hortons, right? But I buy the wrap just to make me feel like I'm still going to Tim Hortons because I love Tim Hortons. All right. I will see you in my next video where we talk about the process that it will take you to do your surgery in Canada. All right. Take care and see you next time in my next video. Bye bye for now.